after you said it was fine.
Yeah, I feel ketorol now doesn't work for muscle pain that much. If you have some dental pain, if you have peripheral pain, neural pain, it will control better. Okay. Muscle pain, tramadol is better. So anything which is Ultracet or paracetamol.
So fine.
Better? Okay. Okay, so just keep it down. We'll remove the splint, then you can see. Okay. Hope you're happy with the change. That is important. She's your mum or she's your
big mom?
Big mom. Your mum has also come, right?
No, she's there only.
Upstairs. Okay. Hello everyone. We are here with this young doctor, and she came to us seeking rhinoplasty. It's been a little over 7 days, almost 8 days for her post the procedure, and we'll be proceeding with splint removal for her. She did not have any breathing difficulty. It was an anesthetic procedure, yes, but also one that was desired since a long time. Okay, it's just the okay. The splint has seated your face so well.
Okay.
Okay. Just trying to create some space.
Sir,
Good evening, ma'am. Yeah, he's coming.
Then, no, ma'am. Is she Sunil Richardson?
Yes, yes.
Hi.
She's an MBBS doctor, ma'am, from Hyderabad, Andhra Pradesh. Came for rhinoplasty. Sir is coming. He told me to proceed.
Actually, I saw her there. I wanted one.
It's the adhesive which is taking time. Okay. You can rest your head back. Right, right. So this way you need not be tense this thing. Okay. Just the adhesive which I'm pulling out. Okay. Now you can have a look.
Okay.
The mirror. Okay. All these marks which you see here are the tape marks that will go. For you, the blue color, everything are the stitches, and they will be removed. Okay. Okay, so we'll see a closer look on what we see on the left. Yeah, now you can have a look as to your before and after, and yes, your. Yeah, so she came to us with complaint of a bulbous tip. The first picture, which is the frontal view, one look and we see, yes, her main complaint really lied with the width of the nose. The width of the nose, I say, not only at this, which is the dorsal width, but also the tip width, the alar width. So as to say, the tip was bulbous, it was not having proper definition. Also, the nose was a little short for her face. I say short because when we see this depression at the radix, it was because of it was lacking dorsal projection. or it was lacking the desired dorsal height, so as to say. This can be better appreciated on the side view, the profile view. So if you can turn onto your right and you can see on the mirror. So if you're able to see your preoperative, which is on your left, we see I'm talking about this depression right at the start of the nose or the radix, which has now been built upon. It's been built by autologous graft, rib in her case, and we see now it's a continuous one dorsal line, straight dorsal line. So it's broad here at the radix and it's narrowing down or pinching down as we come to the tip. The tip has become sharp. The tip was earlier very bulbous. Yeah, you can see these views as well. Also, we'll show you the basal view. You can look up, ma'am. Yeah, so you can have a look at this view, wherein we can clearly see the distance of the tip from the base of the nose. You have to look a little more up, so we can see that yes, there has been a gain of a few millimeters at the tip. That's because the augmentation is right from the radix to the tip. Also, these stitches are proof of alar plasty, so that is the entire width of the alar base, which was earlier from here to here. Also considering the thickness of your lateral alar on both the sides. Okay, these will all go, the stitches will go, the rib sutures will be removed. Yeah, I'll clean everything up. Swelling does exist for you. It's here, osteotomy side, but it is all expected to come down. It will take time because rhinoplasty is a major procedure in the general anesthesia, but it will be better. Yeah?
Thank you.
Thank you. I think you've in fact waited for a day for your surgery. They were very patient with us. How was your experience of coming here? You have come, you can share, ma'am, your thoughts. Even though I'll not understand, she'll translate. She liked it? Hopefully she's saying good words about us. Okay, thank you, ma'am. Thank you, hope to see you in future. If not in person, at least telephonically you can send us pictures. Be in touch. We would love to see how the improvement is once all the swelling settles.
Actually, zero to swelling was there.
This part looks completely pinched. That's because the splint was there. Okay. Wherever, see here, just below your eyes also you can look, there is swelling. Yeah. In fact, around your eyes those bruises have gone now, but initially there were a lot of swelling. Tip also has swelling, everything has swelling, entire swelling, it will take time to subside. Okay. Thank you.
Okay, it will come down here and all, it will come down only a little bit. But it's nice, it's get tighter here. All of this is because of the tape that we put in. I'm trying to show you. Do you have the picture here? No, I'll do it. Just tell me how to go here. Yeah. It's for me to have a look also. See. This area also, all will become tight. These two grooves you have, no, it will not get like that again. Wow. Because we've increased the full thing, it has stretched. It will not become like that. The face looks much this thing. Apart from the nose. What do you say for, is it good? Pachikaundu. Pound. Very good.
We can say Bhavandi also.
Bhavandi is also saying it.
For good.
Because she answered like that. Bhavandi. You're from which place?
Vijayawada.
Vijayawada. Yeah. And Vijayawada, I know Vijayawada. Nice city. Vijayawada. Look there now. Okay. Hey, why am I going back there? Look up also. Yeah, there's a lot of improvement there. And then, so we did cosmetic rhinoplasty for this physician patient. We've done work on the tip, radix, dorsum, reduced the width a little bit, various grafts. How's the pain from the rib?
It was fine.
Not much, right?
Fine.
So how many days was it like much and how many days it was like fine?
In the middle of the night I'm getting severe pain.
Sometimes.
Yeah, sometimes it's hurting.
Okay.
But otherwise it
When
was
you move,
fine.
there's hurting, right?
Yeah.
Otherwise, when you're simply lying down, not much.
No.
It'll go away. Whatever little pain, whatever little issues are there, it'll all disappear. You got to take care of your nose, right? And you know what all you have to take. We're giving you the medicines. Otherwise, also take some physical care.
Okay.
Doesn't get hit and all that. That's the main thing. And you're leaving tomorrow.
Yes, sir.
Safe journey. Okay.
Yeah, I have one.
Tell me.
In between, you feel the distance.
Slight difference may be there sometimes. Yeah, it could be there very minimally. Because see here also there's some difference. See here?
But physically you're saying that or?
See here.
Yeah.
So sometimes 1 millimeter, but you cannot make that out. Because only if I come like this and look inside, that will be visible. But from even 1 foot, it's not going to be visible. So don't worry about that. In case it's there also. But yes, I remember that being there a little bit for you anyways. Because it was there when we started, so it's going to be there. All right. Thank you.